Today I am going to talk about the stroke. Stroke happens when a blood clot or a broken blood vessel prevents blood from getting to your brain. A stroke is a medical emergency that happens when something prevents your brain from getting enough blood flow. Stroke is referred to as a cerebrovascular accidents or brain attacks. Strokes are life-threatening and can be fatal. The sooner someone is diagnosed and treated, the more likely it is they'll survive a stroke. Every second counts. Symptoms of stroke: aphasia, trouble speaking or a complete loss of speech, blurry vision or double vision, confusion or agitation, coma, dizziness or vertigo, headaches usually sudden and severe, loss of muscle control on one side of your face, loss of clumsiness, ataxia, memory loss, amnesia, mood swings or sudden personality changes, nausea and vomiting, neck stiffness, passing out or fainting, seizures, slurred or garbled speaking, sudden worsening or loss of your senses including vision, hearing, smell, taste and touch, weakness or paralysis on one side of your face and body. How long does stroke last? A stroke lasts as long as your brain isn't getting the right amount of blood flow. Your brain cells die if they go too long without oxygen from fresh blood. If enough brain cells in an area die, the damage becomes permanent. This can cause permanent disabilities and other changes in your body. Restoring your normal blood flow may prevent that permanent damage or reduce its severity. That's why time is critical in treating a stroke. Warning signs of a stroke. Stroke can cause lots of different symptoms. To recognize the warning signs of a stroke in yourself or a loved one, remember the acronym Be Fast. Balance. Watch for a sudden loss of balance. Eyes. Look out for a sudden vision loss or changes in one or both eyes. Face. Smile. Look for a droop on one side or both sides of the face. Arms. Raise both arms. If you or someone is having a stroke, one arm will sag or drop in a way that it usually doesn't. Speech. You or someone might slur your or their speech or have trouble choosing the right words. Time. Time is critical. Call for help immediately. What causes strokes? There are two types of strokes. Ischemic strokes usually happens because a clot blocks a blood vessel that connected to your brain. Issues that can cause these kinds of clots include atherosclerosis, atrial fibrillation, clotting disorders, heart defects, microvascular ischemic diseases. Hemorrhagic strokes. Hemorrhagic strokes happen when a blood vessel in your brain breaks or tears. Brain aneurysm, brain tumors, high blood pressure, moya disease. Transient ischemic attack. A transient ischemic attack, sometimes called as mini stroke, is like a stroke, but the effects are temporary. These are 10 warning signs that a person has a very high risk of true stroke. A person who has a TIA needs emergency medical care as soon as possible. Risk factors are older than 65 years, smoke or use of other forms of tobacco or nicotine, use recreational or non-prescription drugs, having certain health conditions can increase your risk of stroke. Alcohol use disorder, COVID-19, frequent migraine headaches, high blood pressure, type 2 diabetes. Diagnosis. A healthcare provider will diagnose a stroke using a combination of neurological exams and tests. Blood tests, CT scan, electroencephalogram, electrocardiogram, MRI scans. If you want more information, please like, share and subscribe to my channel. Thank you.